Well, of course it's bone spurs. What else could it possibly be? This guy. Hi, I'm Joe Alton, MD, also known as Dr. Bones of doomandbloom.net and co-author of the Survival Medicine Handbook. And my friend here doesn't have skin conditions that can cause itching or irritation, well, because he doesn't really have skin. You, however, could get infections easily that could get your dogs to howling, and I don't mean your pet chihuahuas. Athlete's foot is also known as tinea pedis, and it's an infection of the skin caused by a type of fungus. This condition may be a chronic issue and could last for years if it's not treated. Although usually seen between the toes, you might also see it on other parts of your feet or even on your hands between your fingers. It should be noted that this problem is indeed contagious. It's passed by sharing shoes or socks, or even by stepping on the same wet surfaces as people who have tinea pedis or athlete's foot. Any fungal infection is made worse by moist conditions. People who are prone to athlete's foot commonly spend long hours in closed shoes, keep their feet wet for prolonged periods of time, have had a tendency to get cuts on their feet or hands, and sweat a lot. Now, to make the diagnosis, you're going to look for flaking of the skin between the toes or the fingers. You'll look for itching and burning of the affected areas. These areas are going to be red and irritated looking. The nails may be discolored, yellowish, and there may be fluid drainage from surfaces that have been traumatized by repeated scratching. Now, if the condition is mild, keeping your feet clean and dry may be enough to allow slow improvement of the condition. Oftentimes, however, topical antifungal ointments or powders such as miconazole or clotrimazole, Lotrimin in the US, are required for treatment of the condition. In the worst cases, oral prescription antifungals such as FLUCONAZOLE, DIFLUCAN, are needed. Now, don't use anti-itching creams like Benadryl very often. It keeps the area moist and may delay healing. Now, if you have athlete's foot, make sure that you dry your groin area before your feet after bathing, and put your socks on before you put on your underwear. Now, this can stop fungus from spreading from your feet to your groin, which can cause jock itch. Now, a favorite home remedy for athlete's foot involves placing this tea tree oil liberally to a foot bath and soaking for about 20 minutes or so. Dry the feet well and then apply a few drops onto the affected area. Repeat this process about twice a day and try to keep the area as dry as possible between treatments. Now, an ounce of prevention is worth a pound of cure, and here are some ways that you can prevent yourself from getting athlete's foot in the first place. Keep your feet clean and dry. Dry between your toes after swimming or bathing. A lot of people forget to do that. Wear shoes or sandals that allow your feet to breathe. When indoors, wear socks without shoes. Wear cotton socks. These will absorb sweat, and change your socks frequently. Make sure you always do that. Use talcum or antifungal powder on your feet. Allow your shoes to air for at least 24 hours before you wear them again. And wear shower sandals you go into public pools or public showers. Now, don't forget to apply tea tree oil once a week before putting on socks and shoes. You might consider athlete's foot a minor annoyance, but in survival situations, you've got to be at 110% efficiency. And sore feet can be a hindrance to your succeeding if everything else fails. This is Dr. Bones wishing you good health and safety no matter what the times are like. Remember my website at www.doomandbloom.net, Nurse Amy and I's Twitter at Prepper Show, or Facebook, Dr. Bones and Nurse Amy. Thanks so much.